connected. So hello, everyone, and welcome. It's so exciting to see you all back here. I recognize many faces from our last webinar, including our last speaker. So it's excited to see you here, Maria. Welcome back, everyone, or welcome for the first time for everyone who wasn't able to join us last week to our Family Engagement in the Trenches webinar series. This is our second out of 3 webinars. So the next one will be same time, same place next week on Tuesday. And this webinar is really about administrator planning and organizing. And we're super excited to test out kind of a new format this week, which Lucretia is going to tell you all about more details. But yes, please introduce yourselves in the chat. We'd love to know who's here. We would love to see your wonderful shining faces on Zoom if you're willing to get off camera. Our real hope today is that this is going to be a conversation. We've got some really amazing expert panelists, but we also want to hear from you guys. And so we hope we'll kind of take this opportunity to get to know each other, to get to know our panelists and really learn together. So we will make sure that we post the recording up afterwards. We'll get our slides up. We'll be sending all those details and stuff out afterwards, so you don't have to worry too much. And without further ado, I don't want to take any more credit for this. It is really Lucretia Delgado, who is on our Parent Engage team, who has been organizing this whole series. And so I'm going to pass it over to her to introduce you to our panelists and get us started.
So hello, everyone. I'm glad to be with you all today. Super excited for this new thing that we're going to try out. What we want to do is have like a town hall where everybody is encouraged to not just ask questions in the chat, but offer suggestions as well. So we want to hear thoughts, questions, suggestions, everything. The questions will be put up on the screen and there will be a question number. So go ahead and put the question number that you are responding to in the chat. We are going to have a wonderful conversation with you all. And I am so grateful for these 2 ladies who have been so kind and not just agreeing to answer the questions on camera, but really help me to put together what kind of questions would be important to you all and what they would like to see shared. So I would like to introduce Nyanda Finley de Santos. She is the Director of Family and Community Engagement in Community Services for Children, Allentown, Pennsylvania. And I'd also like to introduce Miss Liz Bender, Family and Community Engagement Director for Youth in Need in St. Louis, Missouri. Welcome, both of you. Thank you again so much for taking the time today to be with us and to help us facilitate this new venture that we're on. So to start it off, we are going to start with question 1, and we're going to start with Nyanda. And Nyanda, our question is, what kind of reports are you putting together, either as separate assessments or combined?
Well, we do a lot of reporting. Internally, we use a monthly report, which is really data that comes out of our Child Plus database. And really looks at compliance. So we're pulling information that helps us to make sure that we're on target in terms of where we need to be at each point during the year. We also do a quarterly statistical report, which is used primarily in-house, but also shared with Policy Council and our board. And then the sample that's on the screen is just really a mini sample of how we customize Child Plus modules so that we can gather and capture data at different points in our relationship with families. So our home visitors are really asking questions both in the family assessment, which is, family partnership agreement, which is the first module, and then the parent contact summary, they're asking more questions. And then we're pulling information to provide data tours. So data tours for the FA2, it was really useful to have all of this information in a way that we could fairly easily pull. Fairly is always the bottom line. But we pulled it. We counted. We also do beginning, mid, and end year reports, which are both statistical and narrative that take a look at Child Plus data. They look at our parent gauge information. We do quite a few in-house surveys using SurveyMonkey, where we ask families for feedback. And so that information is captured as well. We're looking at progress towards our program goals, and that happens every quarter. Really making sure that we're on board with what we say we're going to do, or making course corrections, which we've had to do in the last couple of years. We realized that the questions we were asking weren't the right questions, so we have to shift those things. We do the obvious, self-assessment and compliance monitoring reports as well, which we really take advantage of the opportunity to engage all of our stakeholders. And that's a fun process. We're actually in it right now. So
Yeah.
Good luck to us. And then our annual report is something that really goes out to our community and all of our stakeholders and really represents the program as a whole.
Awesome. Liz, same question for you. What kind of reports are you putting together, either as separate assessments or combined?
So I love your slide. We are moving to online forms right now. So that process with all the Child Plus information is kind of in flux, but I focused on what I've been really doing lately with starting the year off with a family engagement plan, and it's a cyclical process. So it's informed by last year, but we go into the year with our plan. We conduct a parent gauge in the fall. And then I compile the results from parent gauge into regional team reports, monitoring reports that I send out to the team. I give them some time to look at all the results and think about it. And then I come out to them and try to meet them in person. We try to have like a representative group of folks at the table there, some frontline staff, managers, directors, and we bring a lot of information together. So we're looking at the baseline and growth reports from parent gauge, the open-ended interview questions and responses, performance panel from Child Plus, looking at PIR data, the family services data from Child Plus, referring back to those family engagement plans that we're working off of. And then the teams can bring other data too, their child outcomes, family engagement attendance data, all that stuff. When we look at it together and see how, if the data is making sense to us and what kinds of things we can draw out of it. Then once I have those kind of deeper conversations with the teams, bringing that back with our education director, we compile our information together into a report twice a year that goes to the Office of Head Start. So we do child and family outcomes together and try to tie that information as much as possible together. And then after that sort of official report's completed, we present it to our policy council and to our staff at an all staff meeting and submit it, and then go around again.
Start the process.
Yeah, so we're always kind of reflecting and looking back at what we were doing, asking ourselves questions about how we can improve our plans and what we want to do moving forward. So.
And that ties in great with our next question, which is what specifically are you looking for in your reports?
Yeah, I think you have something up a slide for me, but so lately I've been in terms of parent gauge, really looking at the difference between our parent trends and our program trends. So asking ourselves how parents are rating us, and then how they're feeling about different things. And sometimes those overlap and sometimes they don't. So I think that kind of tells us like areas where they're looking for our support, and then areas where we're giving a lot, but maybe it's not exactly what they need, or maybe there's something different that we can change to adjust to help them. And we also want to tie that back to our Child Plus data. If parents are saying, I feel very confident in my child meeting their health requirements or going to the dentist, is that looking the same way in our Child Plus data or other places where we get data? We're also looking for inaccuracies, like what are we getting wrong? So in a meeting recently, we had a region that was kind of discouraged when they saw some numbers from Parent Gauge that they were getting lower responses from parents around health. Is the program helping them meet their health requirements? And when we were able to dig into it and saw exactly which families were answering, giving us those low scores, we realized they actually have a lot of foster families in that area. And those foster families have a lot of experience already with the children in their care. And so they just didn't need our support the way that other families might. And so we kind of talked about like what to do in that situation so that we might ask them, do they want to just not answer the question or some kind of NA response so that the data actually accurately reflects those families that are coming and looking for that support. So just kind of like looking at trends, seeing where our program strengths are. And then my team uses them to inform like our particular team goals. So I'm part of the services team. So I'm looking at like, do we need to make goals around dentals or health, things like that. We do have a dental goal right now, kind of tied back to Parent Gauge. And some of our initiatives that we're doing, like a health van that's getting out to more of our rural communities to help them get those access to services that they might not have otherwise had. And so I'm really looking at it from my lens of my team, which is health and family services and nutrition. And so I'm really relying on our operations directors on a regional level to give us more information about what they might be doing at their particular sites that are going to be showing up in the data too. So I'm kind of sharing with them what I'm seeing, but I'm also hoping that they can really find more of those nuances of like, why did this maybe go up or why is this not going up? Things like that. So, yeah.
Nyanda, same question for you. What specifically are you looking for in your reports?
So we're really looking for growth, whether that be at the individual level or across caseloads or the program. And then we're also looking for compliance and making sure that we're doing what we say we're going to do, both according to our grant and also according to what's required. And I would say that we really ask a lot of questions along the way. So this is an example of a end of year quarterly report that we use and really take a look back over a couple of years. And anything that's more than 5 percentage points to me is like, that's not just an anomaly. There's a story there and I want to capture those stories. So for example, in this example, we had, a decrease in our participating in family workshops from 55% to 24%. Well, it would be really easy to say, oh, pandemic. Well, guess what? It's true. But also what we were able to offer in person changed. So we had really good participation, 55% in 2019, 2020, up to the point that the pandemic hit and March occurred. So we were on target there. And the following year, obviously, that decreased significantly. We were able to look at where we grew. So we had re-emphasized the importance of developing individualized engagement goals with each family, which is something that our home visitors and early Head Start and Head Start do with every family as part of their family partnership agreement. We realized we needed to do some additional training in that area, invested the time in training them and retraining them and making sure that they really understood what the expectations were and how to do that in a way that wasn't intrusive for families who you're just meeting. Everything that their work does is relationship oriented. And so it's really important for them not to come in with so many assessments that families don't know what they're doing and wish they were not a part of our voluntary program. So that was another thing. We were able to kind of dig down and figure out where that increase came from and give ourselves some pats on the back and then make sure that we can maintain it over the course of years, right? I would say, one of the things that I've learned over the years, and we have so much information available to us that it's really not to just trust what the data tells you. And it's this spring off point for dialogue, right? So if I don't know what it means when I'm looking at it on a screen, then I'm scheduling a meeting to talk to the people who are doing the work. Nobody is more invested in the outcomes of family and community engagement than the folks who are actually doing the work.
Yeah.
And so I really trust them to be able to tell me, what's really going on here? What are the questions that we're missing? Or did we get it wrong? We're targeting this area, but you're telling me 75% of the families on your caseload are struggling with food insecurity. So maybe I don't want to spend so much time on this topic. And I really want to dig in over here and figure out where are those resources and how can we make lifetime referrals. So we do that work on a regular basis together. And I think that for me has been a really helpful process because my team does know. They know exactly what their families are experiencing. And it's one of the unique features of our home visitation is that in both Head Start and Early Head Start, we have people in the homes every month. And so they're able to tell us, obviously Early Head Start is every week, but Head Start, we have monthly home visits. And so they're really able to tell me what's going on with the families you're working with. And that helps me a lot, to be honest. It really helps to get to the right questions.
Good. So everyone, help us out, share with us, put it in the chat. What specifically are you looking for in your reports? We want to hear from you guys too. So please go ahead and do so. Nyanda, I'm going to ask you to stick with us. I'm going to ask you another question. How do your reports help quantify your CQI requirements for OHS? How does that work for you?
Well, for me, it just depends on the year. Some years there's nothing in the realm of family and community engagement that ends up on our CQI. And that's, it's just the luck of the draw. So when there are areas, like I said, we're constantly reflecting and looking at the data and having conversations. We do a lot of course correction. We allow the information that we receive both from our assessments and also from our families to change what our plan is for the next year. And we don't need a formalized plan to do that. It's just what we do. If it is part of a CQI, then we really look at what are the questions we need to be asking to get to the right answers, right? What are the outcomes we're anticipating or hoping for? And then are we asking the right questions? Do we have the data that's going to support it? Is there something else that we're missing? Is there another entity involved? Are we working with a partner in the community that really needs to help provide some of the data to us so that we get a full picture of what's happening for families on the ground?
Good, thank you. Liz, your turn. How do your reports help quantify your CQI requirements for OHS?
So our family services right now isn't a focus of our CQI in particular, but just in general with our report that we send to the Office of Head Start that we kind of try to tie into those child outcomes. I've kind of been doing a little bit different every time. This past fall, since this is going into our third year of data, I was able to compare how things looked 2 years ago to now and really kind of reflect on the fact that it was a little discouraging to just look at what are our lowest numbers every time. And
right.
See that they really are, it's that family engagement again, it's that family engagement again. But then when I was able to compare it back over time, I saw that's where we've had the most growth. So that was really exciting for me to see. And then I was so happy to share that with staff too. And it makes sense, right? Because we were coming out of such a difficult time a couple of years ago. But I think that it's been a good booster for our staff and shown that we are pushing forward and we are doing better in these areas. And like I said, we had that dental goal. So you can, those are also two areas where we had some of the greatest growth. So now we're just kind of focusing in. One of my goals for this coming year is, what can I do program wide that was really going to impact some of these family engagement goals, and how can we do a better job collecting that data, since it's kind of in silos right now with our different regions. They collect their parent committee attendance and all of those types of activities independently, but we don't have one particular place where we can compare across and say, compared to last year, how are we doing as a program? Are we growing that attendance? Are people ready to come back in person? Are they still coming to things that are on Zoom? Because we still have policy council on Zoom. So are they getting used to it and they're feeling comfortable with that? Or are they really pushing to go back in person? So I want to take a deeper dive into that and look out at our whole program and see what we can learn. So if anyone has any great suggestions of capturing that kind of data collectively, I would appreciate it.
Okay, let's see here. Are you finding duplicate information from multiple assessments? Or if you aren't right now, have you in the past? How did you deal with that?
Yeah, so I've been in this position for about 1.5 years, and as I was going out to talk to teams, I kept hearing, oh, but the parents, we just keep asking them the same questions and they don't want to do this anymore and things like that. So I got with our client services committee members and said, what other surveys are they getting? What else are we asking them? What's going on? And we looked, and some subsets of our families were getting up to 7 surveys a year, because we had an agency survey and we had our Head Start and early Head Start surveys, and we had a parent gauge survey. And so we realized, whoa, this is too much. I don't think we've ever looked at it in terms of like all of them grouped together. So we actually had somebody look at every single question on all of those surveys and see where we were asking really about the same things each time. And we were able to cut down on the number of questions in some of those surveys. And then we made the decision to go from 3 to 2 parent gauge surveys annually as well. So they may still be getting 5 surveys or something, but the total overall number of questions that they have to ask or answer is reduced greatly. So we did find that, yes, but we hope it's better this year. So
Good.
Yeah, so kind of on the opposite end of things, I've been in this department for 22 years. So there's been a lot of change over the years.
Yeah.
And we've had to really look at what we use in terms of talking with families, mostly because we always want to come back to what's the most important element of engagement. It's the relationship. And so if we're repeating information and annoying families, and then, by the way, not ever using all of the data that we collect, because you couldn't possibly, we've really had to fine tune that. So we use Child Plus modules. We've got a lot of customized modules, and we did go paperless a few years ago. So I understand that struggle. And we really tried to look at what are the things that we really need to know in order to serve families. What does our community assessment tell us? Are there questions we need to incorporate that maybe we weren't asking before? We do use parent gauge twice a year. And we also use a depression screening once a year at the beginning of the year and then the middle of the year to make sure that families are doing okay. And that's really interesting data, and it also really helps to inform referrals and making sure that families get access to services, but it's brief. And then we also have really looked at what are kind of the things that need to be repeated. I want to know every single month whether or not families are struggling with food insecurity. So saying, you ask me that question all the time, you're right. And I'm going to keep asking because you'll let me change. We ask about needs and strengths every month, because what I needed last month may be very different from what I need 3 months from now when we have a relationship and I trust you, right? And making sure that we're having conversations. Most of the surveys that we do are done as part of a home visit with a direct relationship, right? We don't send home stuff for folks to do because we find A, we don't get reliable responses, and B, again, this is about a conversation and creating dialogue with them. So in the context of our relationship, how do you feel about these things that we're asking you about? We do in-house surveys. So we have a parent and interest and availability survey, which we do every year, which really helps us to know by classroom and caseload, what do these families need? What are their interests? And then we use that to kind of draw out the plans for the family workshops for the year and kind of customize that. So it's tailored to the group of families that we're actually serving on an annual basis, looking at schedule, making sure that we learned this year our families, while they predominantly prefer daytime meetings, they still wanted to keep a Zoom parent meeting in there because some of them just can't make it and they like to connect in that way. So we try to tailor our information to the things that we're gathering, but we have really, really pared down. I mean, I think some of my team are on here. I'm kind of a fierce defender of parents and their right to only provide us with what we really need. And so when I have a million people saying, what about this? Could we find them? Could we ask them this? No. unless you can give me a really compelling reason and policy council gets behind it, we can't ask everything we want to know. I wouldn't subject myself to that either.
Okay. If you have any thoughts to go with what has been said by Liz and Nyanda, there are some really great little nuggets in on that question. Please put them in the chat. We would love to talk with you about that. The next question, Nyanda, go ahead and stick around. I'm gonna put this on to you.
All right.
How much do you rely on graphs and visuals to share from your collected data? What does that look like for you all, your graphs?
I guess it depends on what's new in the world of graphs and visuals, what I can try out. We do have some organizational alignment in terms of the graphs that we use. So we do kind of use the same structure so that our data is coming to policy council and the board in a way that they understand, and that's pretty similar. We use a fair amount of graphs, I would say. We do use other visuals. Later on, you'll see how I report out class dojo information to policy council and the board. But we also use narrative, and we capture stories from families and share that information and quotes. And it's one of the things I love about Parent Gauge is I can get all those great quotes. And I don't have to do too much extra digging. But we really try to make it balanced. Our policy council knows what to expect from us in terms of our outcomes data. And they know how to ask questions because it's consistent. We don't switch it up every time based on whatever the new slide is, we try to keep it fairly consistent. And then if it's not working for people, we're flexible. I want to make sure that our data is accessible to everybody and transparent. So if it's not clear, then we'll fix it.
Thank you. That's a great answer. Liz, same question for you. How much do you rely on graphs and visuals?
Yeah. Well, I've been kind of inspired by my supervisor, who is extremely good at data visualization. Although I did just learn one of her secrets recently. There are templates in PowerPoint for data visualization, which I never would have thought to look in there, but she makes very cute things with like pencils and children and all kinds of stuff. I love it. I'm not there yet, but I did take the data literacy course this past year with another colleague, and it kind of inspired me to do more with the family services data because no one had really done much visualization with it before. And I started thinking about too, my position 10 years ago was a family educator. So I had to go in and click the yes, no PIR boxes. Did they receive this or not? And it feels like a chore if you don't know where that goes or what it means, or, what are other people answering or what are families needing? So that was something I did last year, was put it together so that you could see how many services. So we have about 1,000 kids. So this is a count across the bottom of how many families receive the different services. So shout out to our nutrition manager for top spot nutrition information. Right after. But it's interesting to see it this way. And I'm kind of hoping too that it encourages staff to be more diligent about documenting it as well, because they see, oh, wow, now we're looking at this and this is useful information for us. So I'm trying to look at like what is going to be interesting, what's going to be meaningful to whoever I'm presenting to, if it's policy council or staff, and pull out the information and present it in a way that is going to make them think about like, okay, should I think harder or spend a little bit more time documenting this so that we can really see this bigger picture together and decide if we want to do more with our parenting curriculum. That's huge. Or do we want to do more with prevention education for tobacco use, those kinds of things. Maybe that's an area where there's not as much interest, so we don't need to spend as much time on that. And I think you can even drill it down to like, what kind of handouts do you want to have available in the lobby when somebody comes into the center? It can be something really simple as that you can pull out of this data. So I think too, where it's another tool to help bring the data literacy of our staff up to a level where we want them to be, so that they're not just entering information, that they're thinking about the long-term impact and use of what they're entering. So using it as a tool in that way too.
Great.
Mhm.
Well, Head Start has so many stakeholders. Who are your stakeholders, and what do you include specifically in their reports? Liz, go ahead and answer that one, and then we'll move on to
Sure. I think my sample slide was for our policy council. So showing them the top parent trends, just kind of making it colorful, interesting to see. That's one of our stakeholders. We present, if you think back to my little circle, to staff, the Health Services Advisory Committee, our childcare partners. That one's a little bit trickier of an audience because we have 11 partners. You kind of meet with all of them at the same time and presenting the information. So I want to make it impactful to them, but also recognize that like some of them have very few children, some of them have a lot, some of them are doing all different kinds of things. And so their data is going to look very different, but wanting them to take away what they need out of the presentation. I would say we also present information like at different coalitions that we belong to. The one that I go to is the Immigrant Service Providers Network. So adapting that information to them. Just really, it can be a lot of different folks. So making it interesting, accessible, and relevant to all of them is really important.
Great, thank you.
Mm-hmm.
Nyanda, same question to you.
Well, I always start with families. So we share information with families about our outcomes and how this, kind of what we're learning from what they're telling us, right? Because they're informing their own services. So we do that through home visits and through family workshops. Our policy council families receive slides like this on a semi-annual basis. We also have service area committees where we're talking to a core group of policy council members about family and community engagement services and what it is that they'd like to have happen or what's working well. And so we get that feedback regularly. We talk to our board, and I do, again, kind of value that transparency of data. So what I share with policy council is what the board also gets. They don't get anything special. Because really, ultimately, the most important stakeholder I work with is the families, right? They're the customer. So everybody kind of gets access to the same data. Our Head Start, early Head Start staff obviously need to be really well engaged with the information. They're kind of the co-owners of the data. Because they're collecting it and they're getting that through their connections to families. And so it's important that they feel well versed and are able to talk about, what do I do on an individual level? What are my parent gauge assessments saying for each family, but also what does it say about my caseload? And are there areas for growth for a specific individual? Are there areas that we need to provide them with more resources? Are there folks who are struggling with their engagement, right? Are there classrooms or caseloads where people really don't feel as connected? And the parents are telling us that in their data. So we really look at that. Our other stakeholders are, like you mentioned, Liz, the community at large, and there's a lot of them and they're all interested, right? So we certainly have, broad program-wide data that goes out to the entire community through our annual report. And that includes stories and examples of impact from the field, but also our funders. What does OHS want to know today, right? That changes from month to month, year to year. What our state folks need to know. We actually have quite a bit of pass-through money coming to us from the state, so we are also accountable to them and their systems. Our local and private donors that we work with all have different things they're interested in. And so we need to make sure that we can tailor the data to meet their needs as well. And then I would say our research partners, we have a very research rich community, and there are a lot of universities and health networks in our area, all of whom really want to work more closely with the 0 to 5 population and their families. And so we have a lot of data that we share with them in partnership, and invite them to come to family workshops and do virtual meetings so that they can explain the research that they're doing and really help parents understand, why do we ask all these questions? And am I obligated to answer them? And then I would say, you mentioned HISAC, and that's something our Health Services Advisory Committee and early learning committees are also groups that we report data to and try to tailor what we're saying based on their areas of interest, really. Right. So how does health impact children and families, and what does that look like in our program?
Thank you. We would also love to hear from you guys. So please put some answers in the chat, put some questions in the chat. We're so excited to be doing it this way. Nyanda, I'm going to ask you the next question. When sharing reports with staff, what staff do you share it with? I mean, I know, of course, you share it with your the staff that ask the questions, do the assessments, but who all are you sharing with?
Oh, gosh, everybody who wants to know and everybody who doesn't want to know. I don't believe in this idea that we're serving people in isolation, nor do we have all of the answers, nor do I want to be the keeper of all of the information. So our reports are fairly transparent. We have obviously parent gauge and parent interest surveys, all of the same things I mentioned, Child Plus, they're all available to staff. One of the ways that we make sure that our home visitors in both Early Head Start and Head Start are engaging with that information is that they're bringing it to supervision. They're pulling their own reports and monitoring their own work, right? So I'm coming to supervision prepared to tell my supervisor how well I'm doing or not, right? And from there, the supervisor is developing a plan for growth and development and supporting them. Sometimes supervisors are looking at other things. They might be looking at attendance. They might be looking at attendance follow-up, which is kind of, it's in Child Plus, but the reports are not always as easy to navigate. So we've kind of figured out what's easy for a staff person to pull and look at and what's challenging. And we pull the challenging stuff and let them pull the stuff that's directly related to their day-to-day. But we look at them together. The end result is never doing to, it's always doing with. And then I would say in terms of the other things that we're looking at, we're pulling teachers into it. And that's actually one of the goals we have for next year is to strengthen that piece. But we're sharing the information through our annual pre-service. We have an annual town meeting that we do where we report out all outcomes across service areas to folks. We talk about how we make decisions and why we've made those decisions. So if we change something up in the world of family and community engagement, we like to share why. And then we really, like I said, I send reports to anybody who I work with. I don't know what they always do with them, but I make sure that it's out there. It shouldn't be secretive. And I want the data to be accessible because I learn through looking at information, and I want everybody else to be able to do the same without feeling like it's always I'm monitoring you. We're monitoring each other. I'm hoping I'll get some feedback from my team who are on the call later.
Oh, great. Yeah. Liz, how about you? When sharing reports with staff, what staff do you share with in particular?
Yeah. So this slide is kind of an example of how I can target the information that I share out to different groups. So because we use parent gauge, they ask questions about a lot of different service areas and things like that. So I even have the ability to kind of pull out information that is relevant to our cooks and our nutrition manager, our health manager, the nurse that we partner with. We can share the feedback that we get with them and show them that cooking in the kitchen and putting down healthy food in front of kids is changing what parents are cooking for them at home. They see the menu, the teachers are sharing recipes sometimes. The kids are changing their preferences of what they like to eat. And it's making a big difference on these kids. So I try to find out what's going to be most interesting and impactful and share it with them. That said, the monitoring report that I put out twice a year has like a summary page on the front. So that I feel like is something that anybody can look at and understand and get the big picture. But I say that and all of the supporting reports and data that go behind it in a specific folder on Teams, so that anybody who's part of that regional team can go in there and dig into it if they want to. And like Nyanda said, like some people are hungry for that and they want to go in there and see all of it. And some people are like, I just want to see, big picture information, just kind of give me the general overview. So I'm always trying to get them excited and more interested to look at it a little bit deeper. So some teams may ask me to share more. So I might put together more of a formal presentation in PowerPoint or something to highlight more than a team that really is confident in doing a lot of that themselves. But yeah, that's kind of how it all gets shared out. And we do present also with at our all staff meeting. So everybody gets to see it there, but that's less personal because it's a program wide overview. So if they want to know really what's going on in their classroom or at their center or their site, then there's different levels of information they can look at. So
and that answered my next question, which was, how does your staff access their data?
That was like a separate question. Yeah,
I will say great.
We also have a family and community engagement committee. So I'll bring some of that back to the committee too, and kind of process that in terms of looking specifically at what they're most interested in. So yeah.
Well, it's wonderful. Thank you. Nyanda, how does your staff access their data? I mean, do you have specific files that they can go to, or they just
absolutely? It's all open and available. I feel like as administrators, we're accountable to our staff. And so that aspect of things is really important to our department, that the information is shared openly and that we have dialogues about things. We ask questions. We interpret data together. And we do that through our in-service meetings. We do it in supervisory conferences. We do it when I run into somebody in the hall and I'm curious. I mean, one of the things that we've really done over the years in our department is to cultivate curiosity and a sense of wonder. And what is the story telling us? And if the story is not leading us where we want it to, if it's not what we want to present about ourselves in our department and the work that we do, then we need to start changing our behaviors, right? So we kind of do exactly with each other and as a team, the things that we would want to encourage families to do. We want to dig in with them. We want them to evaluate. We want them to think deeper about the questions that they have, the challenges that they're facing, and the information about them. What's your narrative, right? What do you want your narrative to be? And if it's not aligned, how can you change that? And we do the same thing around data in our department. It doesn't hurt that I have a team full of people who seem to really enjoy information and data. And so we kind of vibe off of that together.
That's great. Again, in the chat, please help us out, put in some information, let us know. We really want to be able to share everyone's thoughts on this. And you guys are doing so great at the segue. I'm really kind of not needed in here. Because the next question for you, Nyanda, is how does the information you gather get implemented into the changes you make to the program?
All the time. We try to have some consistency through a program year with many of the things that we do. And we have some traditional practices in the way that we operate and the types of services that we focus on for families. But in terms of the changes that we make, we believe in flexibility and agility. I had a previous director for many years who taught me, like, we need to be like cats, right? So we always land on our feet, but we always need to be able to flex. And so that's something that I was drilled into my brain. It's drilled into the department. It's how we operate. We pivot, and we pivot well together. If we're not together, it doesn't work. So we act as a team at all times, good or bad. we really look at, what are some of the things that we have to do? So in this recently, like within the last few months, it came up in our early Head Start home visitor group that they've really seen a rise in domestic violence. That wasn't a key area of service for us because it isn't common. But it was coming up more and more, both in Head Start and early Head Start. And so we were able to reach out to a local provider and get them in to do some extensive training with the home visitors. We have one scheduled on Friday, and really figure out what do we need to do to make sure that staff are feeling comfortable and prepared, and that the resources that they have are up to date. Right. And so that's one of the examples I would say on an annual basis. I mentioned it earlier, but our family workshops, our parent interest survey is really used to determine what are the suggested topics we're going to use this year. And by the way, if we do that at the beginning of the year and the group of parents changes because people are moving in and out fluidly of classrooms, well, then we change it up. I'm not going to force you to listen to topics that were selected by somebody else. So we really try to listen harder than anything else. I would say a great example is just the fact that we have a data team at our organization for years and years. We would have meetings, self-assessment conversations, like we wish we had somebody or some people who could just focus on data, just dig in and really make sure that across the board there was some accountability and consistency, and that we weren't all siloed in what we were doing. And so we have that team. Right. We put it in place as a goal. We worked, every director was like, I'll give some of my budget. We'll make this happen. We need to have this happen. And now we have a fantastic team, some of whom are on this call with me, who really manage that and make sure that I can dig in, because they're taking the hit and making sure that it's accurate and giving me feedback and making sure that PIR is ready to go when it's ready to go. And I don't have to spend weekends here. Right. So I think those are all really great examples of how we put the data into action and try to stay agile.
How about you, Liz?
Awesome. Right now I'm using it for writing goals for my team. So family health and nutrition. It goes into the family and community engagement plans, which are goals that tie back to the family outcomes. And I really encourage like all the other levels of staff to use that information too. So I feel like I'm just kind of like a conduit or like a tool for them to use for them to make their own goals and make their own changes within their individual sites and regions. I didn't really give context, I guess, if you're not familiar with the slide that had the quotes on it, those come directly out of the open-ended questions in Parent Engage. But we have 1,000 kids. That's not families, but so, let's say we have like 800 surveys, there's 10 of those questions for each survey. So that's a lot of reading. And I'm only one person. So I'm really pushing out this information as much as I can to empower these individual teams to do more with it too. Because if parents are writing or saying in their responses, I want more communication from my teacher. I want to learn more about what assessments they're doing. That's all stuff that those staff have to read, and they have to do something with it. So somebody has to take and interpret that qualitative data and put it on paper in terms of goals for their sites. And that's going to look different across the board. So I feel like a lot of my role is just helping people think about what they can do with what I'm putting together, what I'm kind of managing and directing. So, yeah.
Great. Okay. Last question. I'm sure you guys are like, oh, thank you. What potential uses, Liz, are you looking to use the data for in the future?
Yeah, this one I had a lot of things written down. I have a lot of goals. I really want to strengthen the data that we have. So I've been working on, I know Nyanda was like, our staff are so good at doing these surveys. That's a skill we're still building. Them feeling comfortable, giving them understanding what the questions are asking, understanding what strong responses look like. And just really improving those interviewing skills. And so that's one part of it, and empowering our other teams to understand and use the data too. And because we have different places where it lives. We have Child Plus, we have Parent Gauge, it requires a little bit more skill to look in these different places and compare the information. So encouraging them to do that. Looking at the difference between those parent trends and the program trends, and like thinking more about what I can do with that information. And what does that mean if our parents are rating themselves higher than our program or vice versa? What am I going to do with that information? Working with our childcare partners is a big area of growth that we can do more with. We've gotten our staff on board and excited about it. Now we need to work with them as well. And then 2 areas that I want to do more data collection. I already talked about the family engagement, participation and events, and looking at that on a program level, and referrals for services, seeing what more we can do in terms of collecting that and looking at it more. So I have a lot of goals.
You have a lot of goals. They're good ones, though. They're good ones. Nyanda, how about you?
I would say, for me, family engagement is really kind of both a cornerstone of Head Start, but also the secret sauce. And really, when we have those relationships and we're all invested and we're all moving in the right direction towards self-empowerment for our families, we can achieve pretty much anything, frankly. And so I want to be able to spread that across our organization and make sure that all of the departments feel the same way about the data and the possibilities that we have to encourage families to really to take control of their lives, really. And so one of the areas that I'd really like to focus in is around parent gauge data and making sure that parents have an opportunity, teachers have an opportunity to really engage with that data and understand what it means and work on coaching in certain areas. So if the information is telling us that a teacher is struggling in blank, how can we as a team wrap ourselves around them and support them in developing those skills and their comfort level? Because sometimes it's really, that's all it's about. And I would say during the pandemic, we had started to make movement in that direction pre-pandemic. And then with all of the isolation that occurred, I think and turnover in staffing, it's time again to re-engage with that information and make sure that they're feeling connected to those outcomes and realizing, your simple act of greeting a parent in the morning and making sure to give them a positive note at the end of the day is enough to change the picture for your classroom. It isn't actually rocket science. I think sometimes it's so simple that it trips people up. And so I think making sure that they're feeling connected to the data and they take some ownership of that, and that they realize we're not dumping this on you. It's not one more thing. It's how can engagement and as a whole increase the value of the work for you and also for the families who are receiving the services.
That's awesome. Thank you. And put it in the chat, please. Everybody, let us know how things look, what you guys have planned for the future. And let us know if you like this setup, if this works for you all. We want to know that too.
You want data on the data.
That's right.
Yeah. All right. Well, before anything else, before we get to Q&A, a massive, massive, massive round of applause to Nyanda and Liz. It was so wonderful to hear from both of you, to, hear from some people in the chat chiming in as well, which is so exciting. As I look in the chat here, there's some questions popping in, people loving hearing from you, which is so wonderful. All right, so there's one question in particular I want to make sure we run through, which is someone had asked Nyanda about what depression screening you use for your families. And luckily one of your colleagues was here to throw in the chat that you guys use the PHQ-9, but wondering if there's anything else you want to share with that, maybe kind of how you tie it together with your other work.
Well, it's just been really easy. We do it kind of in our second or third home visit. So we've already met with them. We've already cultivated a level of trust and relationship, and it is optional. I mean, it's meant to serve families. What we find more often than not is that we do have families who are struggling with depression and that they're already receiving services or need to reconnect with services. And so it's our opportunity to do that. We do it then later in the year as well, just to check in on them and to make sure if things have changed for the family, which, right, everything in life changes, that we're able to address those needs while we're still serving them. But I would say, it It's taken time to train staff to feel comfortable in using the tool. But again, we always bring it back to, we have this fixed amount of time with families. And if we don't really bring out all of the effort and energy during that time and invest in them, then they're not going to get what they need out of the program. And we can't count on anybody else in any other systems to pick up the slack. So.
Awesome. All right. Well, you guys shared so much. We are close to the end of the hour. I know there are a couple questions in there around, the parent interest surveys that people do, kind of examples of how to get data. And I will, of course, as a member of the Parent Gauge team, plug Parent Gauge. I know there's some examples you guys shared from that, but I will also say, our team is super happy to talk to you about those specific tools and kind of how those data pulls work on our side. So if anyone's interested, you can shoot us an email or just throw your name in the chat and we'll collect it and find you later. I'm trying to run through any questions here really fast we can use in our last couple minutes.
We're open to sharing if there are things that people want to take a look at. If you let me know, we'll share them with Lucretia and they can get out to folks.
Thank you. That's wonderful. Thank you.
I think one of the biggest things
I'm excited too.
I think one of the biggest things that I'll share from what I've learned from talking to people, and hopefully you too, but also everybody else here would be willing to share, and maybe on the block we can get a conversation going, which is we do collect all this information, right? You get so many data points about families, and it is really hard to use it all. And so, would love to hear some examples from you guys and everybody else in the audience of like, what is one piece of data you saw? Like I had my Parent Gauge report and I saw this thing, say, Liz, like your example about the dental support for families, like what number did you see and how did you add additional information into that to say, yeah, this is a goal we need to set. Here's the change we actually made, because that really narrows it to like, how do I find one piece of information for it? Love to hear some of those.
I think because I've been here a year and a half, like I think some of the things were kind of already put into place before. And so I can see that ripple effect in the data. But I don't know that I have like a beginning, middle, and end yet of something to that extent. Although I hope to have one for our parents feeling more connected to their peers and community.
All right. All right. Well, we are at 2:57 on time here. So thank you all so much for joining.
Thank you.
Thank you, Lucretia, for pulling this all together. And for our amazing panelists for speaking today. Hopefully you saw in the chat everyone who was just so happy to hear from you. And we would also love to hear from you guys and continue the conversation. We have one final webinar in this series, which will be same time, same place next week, Tuesdays at 2 p.m. Eastern. It'll be the 28th next week. So we'll be out the month with our Parent Gauge team. And thank you all so much. We'll stay in touch. See you next week. Bring your friends and colleagues along next week for staff interview sensitivity training.
Yeah, thank you guys. Thank you so much, everyone, for participating. Take care.